Sunscreen contouring, poop face masks, UV index tanning, and breast milk facials. What do these all have in common? That's right, these are the crazy viral TikTok trends, and we're going to go review them today. Hi everyone, I'm Dr. Alexandra Brown. I'm a board-certified dermatologist, and welcome to my channel. If this video sounds interesting to you, or if you're interested in more skincare tips, make sure you hit that subscribe button. We're going to go and watch our first sunscreen contouring video. I have not seen these yet. I have a lot of words. I can't believe this is even a trend and that it's circulating. Sunscreen contouring is just a really bad idea. That's what bronzers are for. Sunscreen is meant to protect your skin, so everywhere you're not applying your sunscreen, you're increasing risk of skin cancer. And you don't have to burn to get skin cancer, you just need a tan. But leaving parts of your face unprotected, you're exposing those parts of your face to the harmful UV effects. UV not only comes in UVB, which causes you to burn and cause skin cancer, also comes as UVA. When you see UVA, think aging. So UVA has longer wavelength, penetrates deeper, and it gives you wrinkles. So why would you want to sunscreen contour when we have so many contouring products in the market nowadays is beyond me. Please don't do this. Use SPF at least 30, apply to your entire face, and then if you want to contour, that's what contouring is for. Use the contouring products for the use that they're intended, and sunscreen for the use that it's intended for. Our next video, I don't even want to know, but this is face fecal mask. Again, I have not seen this, so...
Maior loucura que fiz na vida, passei coco no rosto para hidratar e resultado ficou surpreendente.
Cannot. She just applied poop to her face. I would love to think that this was fake. Maybe it was, but I would really love to think that this is fake. This is absolutely shocking to me. The idea of taking your own feces and applying them to your face. Our fecal matter is full of bacteria such as E. coli. If you have any sort of breakdown in the skin or a compromised skin barrier, you are increasing risk of infection significantly. This is just crazy. Let me be clear. Using poop as a face mask is not hygienic, and it is extremely dangerous because it increases your risk of infection that we typically don't see on the face. So if you were to get a breakout afterwards and not disclose something like this, we would never think to treat for E. coli on the face. We would think to treat for bacteria that we usually see on the face, which is things like staph and normal acne-causing bacteria, not E. coli. E. coli is specific to the GI tract. That should never make it on the face. In addition to the fact that risk of infection is extremely high and it's going to be extremely difficult to treat because the bacteria is not commonly found in the face, there's literally no scientific evidence that this is beneficial to your skin, none whatsoever, so don't. If you want to help improve your skin texture, opt for normal things like we all use hyaluronic acid to help hydrate and plump your skin, vitamin C and antioxidant to help fight free radicals and keep your skin protecting from UV light, sunscreen every morning, and retinol at night. Those products will get you so much further than applying poop to your face. Let's watch our next video. This one's on UV index tanning trend.
This is my time to shine. What is a good UV index to tan at? What is too low? Well, for me, I don't even take the time to go outside if it's 5 or lower. 6, sometimes I don't even take the time now that it's so high because it's summer. You say that you burn pretty easy. I would just wear sunscreen, but the best UV index to go out is obviously 11. And 11 occurs from times 11:30 all the way up to 2. But yeah, those are the prime times to tan.
Y'all, this is literally what we tell you to avoid. The idea that you're using your UV index to figure out when to go outside to get the best tan is beyond me. We specifically in my household have rules of you should be wearing your sunscreen. UV index are about 2 or 3. UV index 6 or higher, you should be wearing SPF shirt, not just the sunscreen. So the fact that she's trying to go outside with UV index of 11 and tan, and then she apparently burns really easy. That is so scary. Not only are you going to have wrinkles, she probably doesn't care about wrinkles at this age, we all get it, but this is so dangerous because you're increasing risk of precancers and skin cancers, and you don't think these are going to show up now, and they're not going to, but they will in 20 to 30 years. Precancers and skin cancers are a result of chronic cumulative sun damage. Even people who spend very little time outside, but on chronic basis, develop precancers after the age of 50. If you're tanning to this extent, odds are in your 20s or 30s you will develop basal cell skin cancer or squamous cell skin cancer, or maybe even precancers such as actinic keratoses. Hopefully not melanoma, but you are increasing risk of melanoma every time you burn. If you really want that bronzed look, there are self-tanners. They come in wipes, foams, lotions. They're very easy to apply. Even for myself, I don't consider myself an expert on how to apply these, and I've been able to do it just fine. They even make bronzing lotions nowadays that you can apply prior to the event to give your skin that nice golden bronzy look. And this is with no UV, no tanning. And even if you wear your sunscreen, SPF 30, you're still gonna get a little bit of tan. So why would you go out at prime time of UV index of 10 or 11 is beyond me, because this is recipe for skin cancer. Remember, sun damage is chronic and cumulative. So just because you didn't burn yesterday or this summer doesn't mean it's not gonna catch up to you, because what you did 20 to 30 years ago is gonna come back to haunt you. So for all the 20-year-olds right now who are tanning, please reconsider. All right, our next one is breast milk as a Botox replacement. Curious to see this one. Okay, breast milk does not replace Botox. First of all, Botox is a neuromodulator. It paralyzes your muscles so that you don't move. Breast milk will not do that. Breast milk is rich in lipids, triglycerides, fats. It will help hydrate your skin, certainly, but do you really need to use breast milk for this? She took hers directly from the freezer, applied it to her skin. It's probably her breast milk. I don't think it's the end of the world, but breast milk isn't good for very long. Once you pump it, it's good on a counter for 6 or 8 hours, if I remember correctly. Once it's thawed out, you have to use it within 24 hours. If you let that sit too long, it can go bad. It can grow bacteria. If you apply that to your skin, we're back to almost as bad as poop facials, where you're increasing risk of infection. So if you are looking for Botox replacement, you're using breast milk, that's just not gonna happen. It does not work, not even close. The mechanism of action of breast milk is not neuromodulator. If you're looking for hydration, you will probably get some hydration for breast milk, but why would you want to use breast milk when you have so many good options on the market that sit in your jar just fine on your countertop and don't have to be refrigerated, and you don't run risk of infection if it sits on a counter for too long? While there are some studies to show that breast milk has some antibacterial, antimicrobial properties, there's really not enough data to use breast milk as a skincare, and it definitely does not work like Botox. Okay guys, that is all I have for today. And remember, just because it goes viral on TikTok doesn't mean you need to be doing it. It does not mean it's safe or effective. If there are any other TikTok skincare trends you want me to review, let me know, tag me in the videos, I'm happy to review it. If you found this helpful, please don't forget to subscribe to my channel and comment below any questions or other videos you want me to review for you. Also, for shorter videos, follow me on TikTok and Instagram at Dr. Alexandra Brown, and that's Dr. ALEKS, no X. Thanks for watching. Catch you next time.